ObamaCare sets out to help people, to ensure the uninsured, to provide essential health benefits, and to provide no limit on treatments. However, according to Tax Commissioner Artie Logan, the Affordable Care Act appears to be anything but affordable and may actually be costing more for the people of Guam.
So, of course, the cost of the benefits are going to affect how we pay our insurers. So the insurance company, the issuers, are going to raise their rates to make up for these benefits that are required to be offered to the people of Guam.
Logan says ever since Obamacare was signed into law 3 years ago, meetings with Calvo Select Care, Stay Well, Take Care, and Net Care were held to assess the impact on Guam.
We've met with several of the health insurance providers, and they have their actuaries look at what it's going to cost them. They're looking at up to 55% in some areas where they feel it's going to go up.
Logan says the increase in premiums is just another concern that has plagued not only Guam but the other territories as well, which are treated much differently than the states when it comes to implementing Obamacare. It was exactly 1 month ago when Guam opted out of the health insurance exchange, primarily because unlike the states who receive subsidies to establish it and would be covered by the federal government, the same does not apply to Guam. Logan says to establish an exchange for the first year alone, it would cost $74 million, far in excess of the $24 million 6-year allocation that Guam is slated to receive under the Act. Ultimately, Logan wants fairness and has since relayed the message once again to U.S. Department of Health and Human Services Secretary Kathleen Sebelius in a letter as part of the National Association of Insurance Commissioners. The letter requests flexibility in light of the statute's ambiguity to the territories. Logan says just this week he received a call from HHS saying they're unable to delay or change the law but are willing to technically assist.
I guess they're saying they're willing to advise us on what to do, but the problem still is how are we going to pay for the huge cost of these benefits.
Reporting for Guam's News Network, I'm Ken Quintanilla.